Short-term health insurance is insurance coverage that has a limited duration and limited coverage. These plans can be an affordable solution if you don't want all the essential benefits. Available in a comprehensive Affordable Care Act. Short-term health insurance is available in most states, which can differ in term lengths. But these plans aren't available everywhere. With the recent rolled back in federal regulations, the restriction of short-term plans, which is used to be limited to 3 months. The new rules allow the policyholder to keep their short-term coverage for up to 1 year with the option to renew the coverage for up to 2 years, which also depends on the state you're living. The good thing about the short-term plan, you can apply for this coverage at any time, because there is no enrollment period and you can get your coverage as soon as the very next day. Short-term plan regulations may change depends on one state to another. Some state allows the policyholder to keep their plan up to 3 years while others have tighter restrictions. Although health insurance is no longer mandatory on a federal level, some states implement an individual mandate on a state level. This means you might be required to have qualifying health insurance coverage depending on the state you live in. Some states may have you pay a penalty if you can afford health insurance but you choose not to buy. These are applicable to the residents of California, Massachusetts, New Jersey, Rhode Island, Vermont, Washington, D.C. States that allows short-term health insurance. Each state has its own insurance rules and regulations, meaning even in states where short-term plans are available, the law that regulates it may vary from one state to another. For example, some state will allow you to keep short-term coverage up to 1 year and you can renew your plan as many as 2 times, while other states have stricter rules that allow you to keep your plans for 3 months and do not allow renewals. As we said, it depends on the location you live. Lists of states where short-term health insurance are available: Alabama, Alaska, Arizona, Arkansas, Delaware, District of Columbia, Florida, Georgia, Idaho, Illinois, Indiana, Iowa, Kansas, Kentucky, Louisiana, Maryland, Michigan, Minnesota, Mississippi, Missouri, Montana, Nebraska, Nevada, New Hampshire, North Carolina, North Dakota, Ohio, Oklahoma, Oregon, Pennsylvania, South Carolina, South Dakota, Tennessee, Texas, Utah, Virginia, Washington, West Virginia, Wisconsin, Wyoming. States that short-term health insurance is not available, because the rules of short-term plans are so strict that insurance providers won't sell them, or don't allow the sale of short-term plans completely. You can't get this coverage if you're a citizen of California, Colorado, Connecticut, Hawaii, Massachusetts, Maine, New Mexico, New York, New Jersey, Rhode Island, Vermont. Although short-term health insurance plans are limited to some states, here in Idaho, the availability of the plans is comprehensive. Short-term insurance can be a good option for your situation. It is often worthy for those individuals looking for a health plan in case of emergency or immediate coverage. Make sure you are aware of the components and exclusions of these plans, so you can get the most out of them.